This procedure demonstrates the assessment of the neck. Cognitive lists two major signs and symptoms related to neck problems. Chief complaints: neck pain, lumps or swelling, limitation of movement. Psychomotor, pre-procedural steps. Perform hand hygiene. Introduce yourself.
Hello, good morning. My name is Angela and I will be your nurse for today.
Identifies the patient. Ask the patient's name and check the ID band in MRN.
Can you please tell me your full name?
Sara Al-Utaybi.
And can I check your ID band? Okay. Sarah Al-Utaybi, 143-4455. Sarah Al-Utaybi, 143-4455.
Provide for patient's privacy.
I will close the door and curtain.
Explain the procedure to gain cooperation.
Miss Sarah, I'm going to assess your neck today. Is that okay?
It's okay.
Position the patient comfortably, seated as possible.
I will put you in a sitting position.
All right.
Physical assessment. Inspect and palpate the neck. Symmetry. Ask the client to hold head erect.
Miss Sarah, can you please hold your head in a straight way? Okay.
Inspect the neck muscles, sternocleidomastoid and trapezius muscle, for abnormal swellings or masses.
Head is erect and in the midline. No signs of masses on the sternocleidomastoid muscles or trapezius muscles.
Assess range of motion. Moves chin to the chest.
Miss Sarah, can you put your chin close to your chest?
Moves head back so that the chin points upward.
Miss Sarah, can you please tilt your head up, looking up the ceiling?
Moves head so that the ear is moved toward the shoulder on each side.
Okay, can you please turn your head, your ears touching your shoulder? To the other side.
Turns head to the right and to the left.
Can you please turn your head to the right and to the left? Okay, so there is no limitation on the range of movement.
Assesses the muscle strength. Ask the client to turn to one side against the resistance of your hand.
Miss Sarah, I'm going to put my hand on one side of your face and I want you to resist me pushing you, okay?
Okay.
All right, resist.
Repeats with the other side. Shrug shoulder against the resistance of your hands.
Okay, Miss Sarah, I'm going to put my hand on your shoulders. Please shrug it to resist. Okay, good. There is no sign of stiffness or weakness.
Assesses the lymph nodes. Palpates the entire neck for enlarged lymph nodes. Uses gentle circular motion of finger pads. Begins with the preauricular lymph nodes in front of the ear. Palpate the 10 groups of lymph nodes in a routine order. Preauricular, in front of the ear. Number 2, posterior auricular, mastoid. Number 3, occipital, at the base of the skull. Number 4, submental. Midline behind the tip of the mandible. Number 5, submandibular. Midway between the angle and the tip of the mandible. Number 6, jugulodigastric. Under the angle of the mandible. Number 7, superficial cervical. Superficial to the sternomastoid muscle. Number 8, posterior cervical, along the anterior edge of the trapezius muscle. Number 9, deep cervical, deep to the sternomastoid muscle, inaccessible to examination. Number 10, supraclavicular. Deep in the angle formed by the clavicle in the sternomastoid muscle. Assesses the trachea. Palpates for any tracheal shift. Place fingertip or thumb on the trachea in the suprasternal notch.
Miss Sarah, can you lift your head a little?
Then moves finger laterally to the left, then to the right in spaces bordered by the clavicle, the anterior aspect of the sternocleidomastoid muscle, and the trachea.
Trachea is in the midline and there is no deviation.
Assesses the thyroid gland. Anterior approach. Inspect the thyroid. Observe the lower half of the neck overlying the thyroid gland for symmetry and visible masses. Ask the client to hyperextend the head and swallow if necessary. Offer a glass of water to make it easier for the client to swallow.
Okay, Miss Sarah, I want you to look up the ceiling or hyperextend your neck, and I want you to swallow. Would you like me to offer you water?
No, it's okay. I will swallow.
Okay, can you put up your head, hyperextend, all right, and swallow. One more. Thank you.
Palpate the thyroid gland for smoothness. Ask the client to tip the head forward and to the right.
Miss Sarah, I want you to tip your head forward and a little to the right.
Uses right thumb to displace the trachea slightly to the person's right. Notes any areas of enlargement, masses, or nodules. Hook left thumb and fingers around the sternocleidomastoid muscle. Posterior approach. Palpate the thyroid gland for smoothness. Stands behind the client. Ask the client to sit up very straight and then bend the head slightly forward and to the right side.
Miss Sarah, can you please sit up straight? Okay. Bend your head slightly forward and to the right side.
Uses the fingers of the left hand to push the trachea slightly to the right. Curve right fingers between the trachea and the sternomastoid muscle and ask the client to swallow.
Miss Sarah, can you please swallow? Okay. Both the anterior and posterior approach findings, there are no enlarged lobes palpated or presence of nodules or lumps.
Auscultate over the thyroid area for a brood.
Normally, there are no brewy sound.
Post-assessment care ensures the safety and comfort of the patient, ensures that the patient is covered and is in a comfortable position.
Miss Sarah, are you comfortable in this position?
Keeps the side rails up. Keeps the bed in the lowest position. Bed breaks on. Call bell within the reach of the patient.
Miss Sarah, the call bell is beside you. If you need anything, just press it.
Perform hand hygiene. Document all important findings. Students should verbalize their specific findings or write in the documentation paper.